as employers, we need to be telling them that they should stay at home and they should get tested. In terms of outbreaks and outbreak management, obviously that information, once a positive case comes through, it goes through to Public Health England, along with information about who they've been in contact with recently. If a second case comes up in a particular setting, then that is then considered an outbreak. So that's in any setting, whether it's a hospital, a shop, I don't know, a distribution centre, wherever it is. And depending on the level of risk, we could then call an outbreak management team to kind of look at how we can mitigate the factors and work with that workplace setting. But in terms of, and that could then lead on to kind of other infection control measures that are being asked to put in place in the workplace, isolating other members of staff, which then has an impact on you as businesses in terms of having enough staff members to open the door, for example, and then onwardly on levels of income. But in terms of mitigation, Public Health England have published obviously a lot of guidance, but one of the key documents for every workplace was 5 steps to safe working, which include a need to risk assess the workplace for coronavirus risks. And that's particularly important where we've got people who are in the shielded category, who are particularly vulnerable because they've got existing medical conditions. We need to make sure that they're going to be safe. And if they can work from home, then they should work from home. If they can't work from home, then we need to be looking at what kinds of measures we can put in place that protect them in the workplace. Can they be given alternative roles, alternative duties, that kind of thing? Staff obviously need to be given kind of clear guidance and information about hand hygiene, hygiene around the workplace, sanitation, regular cleaning schedules, that sort of thing. And staff also need to be, as I say, isolating and getting tested if they show symptoms. That guidance is available on the Public Health England and UK Gov website. There is specific information that's been published as well for each business sector that's also available on there. We did make reference to that in our business pack that we produced and circulated a while ago. We will be updating that as we go forward, but it is recommended that everybody stays up to date with the guidance that's published by the UK government, because that's updated more regularly. The other thing that sorry, Paul, did you want to ask any other questions about any of that?
No, not at this stage. I'm more than happy to, if anyone's got any individual questions. I think it's just worth as well just going through some of the points that we said we wanted everyone who was coming onto this call to get out of this. And if at the end of, or towards the end of the session, people feel we haven't covered that, please shout. So we wanted to help everyone on the call understand the local resources available to support businesses and employees through the restart and initial recovery stage. We wanted to inform everyone about the contingency plans for a local lockdown and outbreak, which you just covered. We wanted to talk about best practice and tactics for ensuring employees are confident to return to work. We wanted to provide some key guidance for businesses of how to respond to an outbreak and mitigate risks to business continuity. And we wanted to inform everyone about the regulatory obligations of businesses and the penalties for non-conformance. I feel that points 1 and 2 have largely been covered, but if there are any elements that maybe haven't been covered by either Matt or Shane, then we can potentially come back to that a little bit later. Shane, if you're comfortable, I'll give you a rest for now, and I'll invite Martin, if I may, to join us more formally. Martin, of course, is the chair of the Health and Safety Executive nationally, with a huge amount of experience in industry and at the forefront of the executive. Since May 2016, he's held the position of chair, and today he joins us on his final day in that particular position. So frankly, he can say anything he wants to without fear of repercussion. Thank you very much for joining us, Martin. On this particular period, I'm going to mute myself and let you and some of the colleagues from HSE who are on the call address the audience. I think there's a message in the chat function from Anthea regarding any questions that arise. If you want to post them on the chat, we will then be able to pick those up either during or at the conclusion of Martin's address to us. Martin, over to you. Thank you once again.
Thank you very much, Paul. And you commented the last day. I thought to myself, what would be the most important and vital forum to spend my last day talking to, and this is it. So thank you very much, everybody. And you'll probably hear from me and my colleagues this afternoon some repetition actually of some of the key points that Matt and Shane made. And that will be not an issue at all, because to drive these home still more firmly is, I think, a very important thing to do. So I hope you find the webinar useful. When we're trying to guide people through the challenges of this COVID world, and I suppose I start by saying that throughout the pandemic, our first priority has been and remains so to enable business to work and continue working and protecting those at work at the same time. Now, over the last few months, we've issued revised and, we hope, proportionate operational policy positions to a wide range of industry stakeholders and sectors, and it's constantly reviewed and supplemented in the context of up-to-date science and evidence. And there's a lot of that coming forward, as you heard, this very fast-moving situation. And it's all available on a dedicated coronavirus microsite. And I suggest all of you subscribe to it. It's free, but it means that as things move and things change, it is automatically updated to you, so that your areas of interest are covered and you don't have to sit there and think, I wonder if things have changed or not. And all this stuff is the sort of stuff that ultimately Public Health England and people like that put together in their overall guidance. This was what fed into it. So there is no doubt that the pandemic has highlighted the importance of so many sectors of our economy that probably people didn't realize before. But what has really impressed us have been some of the innovative responses that we've seen businesses and organizations do when presented by COVID-19. And so as we continue to learn, I advise you to network with each other, and the Chamber movement is a fantastic chance for you to do that, where other people have found these innovative solutions, because actually rules and regulations won't cover all your circumstances. You've got to understand the basic principles and how you can best keep your people safe and secure, because if you get an infection in there, it will close your business down. Not because we do it, not because anybody else will do it, it's because the people won't be there and the rest of them may be in lockdown. So find the solutions that other people have found, and I would just say steal with pride. As you know, it's a requirement to do a risk assessment to enable a safe return to work, considering those risks in conjunction with your workers and workers' representatives has already proven to be the best and most sensible and effective approach, because it's instilling a feeling of reassurance in the workforce that the right and sensible measures to keep them healthy have been put in place. Now, at the heart of it is a common sense approach. When the rules are not clear, it's important that social distancing under the prevailing conditions and good hygiene remain at the heart of controlling risks. You've heard that already. It is so important. And apart from PPE, where the task in hand requires it for PPE, for COVID, we would normally say that should be the last resort. It's those earlier things that are really important: distancing and good hygiene, etc., etc. A little bit now on what we've been doing. Now, on our regulatory activity, it has continued, because, of course, many sectors have not stopped working. Some have reduced work, some, of course, have stopped. But areas like agriculture, much of the areas of construction, many areas of manufacturing, particularly food production, financial services and transport and logistics, of course, have been working full tilt. So throughout the pandemic, we have received something approaching 30,000 COVID contacts into our lines, of which about nearly 9,000 of those were concerns from people, and about 8,000 were from people wanting advice on COVID. And of course, in the context of the concerns, most of those we've been able to handle very straightforward and simply, without having to visit or anything like that. But of course, in some cases, inspections have had to result where there are ongoing concerns. We have significantly increased the capacity of our concerns and advice teams. There is a lot of information on the website and also through trade bodies and, of course, the Chamber movement. But if all else fails Our advice and concerns teams are available to you all, and again, it's a free service for you to ask those questions that keeps everybody safe rather than risking doing the wrong thing. Now, it's important to note that across all sectors, we do continue to investigate work-related deaths, which sadly have continued to occur, serious injuries and dangerous occurrences, as well as reported concerns from the workforce or the public where people are thought to be being exposed to risks from work activities. And we have, and will still take action to secure compliance with the law. Now, I repeat that our priority is to enable work to continue safely and healthily. So what I hope is a helpful point, under the Health and Safety at Work Act, employers have a general duty to ensure, so far as is reasonably practicable, the health, safety and welfare of their employees. Now, these requirements continue and have not diminished. Now, in the context of public health issues on COVID-19, HSE considers that if an employer is following the relevant Public Health England, or in the case of the devolved areas, their own guidelines, which we work with, if they follow that guidance in their sector in terms of controlling the public health risks, they will be taking reasonable practical precautions to control workplace risks from our perspective. Now, with regard to guidance, COVID-19 secure guidance for business on necessary safety measures, I think has already been referred to, which everybody needs to adopt, was published on the 11th of May. And that was something we worked with Public Health England and all that to produce. And we've supported that with an HSE guide on working safely during the outbreak and a toolkit to support employee engagement alongside that announcement. We've been heavily involved with others, notably BAYS, the business department, on the return to work guidelines. The two of us have really pulled together to put that together for all sectors and activities over the last few weeks, and much of that now, of course, is in the public domain. That work continues and again evolves as things are known, but still there are sectors like hospitality and beauty sector that still need certain areas of resolution. Now, as I said earlier, we've still been active in the workplace, and as many of you will know, we normally concentrate our visits and inspections on areas where we perceive there is the greatest risk, or in response to specific information which suggests an inspection should take place. However, and actually the Prime Minister repeated it today, in line with requests from the government, we have introduced spot checking. Spot checking businesses for compliance with safer workplace guidance. And this will involve not only our inspectors, but those from local authorities. It's already taking place. And that means that all sectors are in scope for spot inspections. So what may have been considered as a low risk area in terms of the conventional health and safety risks may well now receive a spot inspection, because of course, just working together is where some of these risks on a public health aspect come to the fore. Now, I suppose to sort of reassure people, it's been very gratifying that on public health issues relating to COVID, the vast majority of companies are doing very well and respond very quickly to prompting when small elements are not quite right. And so by and large, people are trying to do the right thing, and that's really good. But just to give you a sort of an idea, some of the common issues inspectors are finding are failing to provide arrangements for monitoring, supervising and maintaining social distancing. As people get used to it, then they start slipping in their diligence, in fact, of looking at that. So actually things slip a bit once you get in that sort of comfortable way of working, if that's the right way to put it. Then there's the failing to introduce an adequate cleaning regime, particularly at those busy times of day. And again, it's been touched on. It's got to be regular, because people going around touching things and doing things. And also providing access to welfare facilities to allow our employees to frequently wash their hands with warm water and soap. Now, also on a point of detail, on the 22nd of May, we published further guidance on managing Legionella risk. And as workplaces open, and in particular when air conditioning units, for example, are started up, then those sort of risks can come to the fore. And it's important just to keep that in mind and check you're doing the right thing. Now, by way of background, for anyone thinking, what have we been doing? From day one of the pandemic, we have been active in a wide variety of areas. And let me just give you a few examples. We worked right at the beginning with Public Health England and the devolved governments and others on the early overall guidance for general infection prevention control, secondary care, handling clinical waste, and of course, prevention of infection from the deceased. Again, from day one, right the way through, we've covered all facets of RPE and PPE relating to use, to reuse, to getting alternatives, and of course, things like fit testing and guidance. We've also had a massive responsibility looking at the testing of PPE from new sources from abroad. And you've heard a lot about stuff coming in from China, and certainly there's been some very bad stories around that. And we've had to knock on the head certain quite large numbers of stuff that's come in that was incorrect. And of course, checking and working with new potential suppliers in the UK to supplement those supplies. We've also looked at the changes to the ways of working in some laboratories to enable them to increase the testing capacity for COVID-19 samples. And you've seen that's been a massive issue through the pandemic. How do we get that testing capacity up? And it's gone up enormously, and that required changes to the way certain laboratories work. We've also been involved on things like unblocking obstacles to enable drinks producers to switch ethanol production from drinks to biocidal hand sanitizer products. And again, that was a massive issue right at the beginning, and as supplies have come on the market, that has eased the situation. But of course, in recent weeks, the return to work and all the challenges around that have dominated our work. And so can I remind you that our various websites are full of detailed information, just about everything you can think of, we've tried to cover on that website. Some of you may find helpful a video produced by Aggregate Industries. It's one of the bigger companies with complex number of sites and processes. And so the bigger member companies may find it useful to watch, because they have actually produced a really good video on how they're handling COVID risk in a very comprehensive way, in a very complex situation, and working in line with the need to run their business effectively and efficiently. There are other videos, but that happens to be one we've seen. Remind you again, look at our website when you need to. Chambers have got lots of stuff, and there is stuff in other places. If you can't get it from those, ring up the concerns and advice team, and I will close at that. Other than to say, we'll try and answer any question. I've got technical people here with me to try and take those things up. If we can't answer it, send it in, and we'll get somebody in the technical team elsewhere, if it's something that's not here today, to answer. If, of course, it's government policy, we can't answer that. That's up to them. Thank you.
Thank you, Martin. I'd just like to open it up to, I don't know if you call it the floor when it's a virtual audience. I'd like to open it up to participants. If you have any questions or you have any particular comments or concerns or points of note or clarification, please either put them in the chat or feel free to speak.
Dave Padden here. I work as a health and safety consultant, and I've spent a lot of time looking through the gov.uk guidance and the HSE guidance. One issue I've come across is the differences regionally or nationally within the UK, mainly between England and Wales. So it's details where they're different. In certain for certain points, England is ahead of Wales, Wales is ahead of England. I think generally Wales is trying to not steer too far away from the English policy. But I think that's an area that I struggle with when I'm trying to put together risk assessments for clients who operate across England and Wales. And obviously there are other companies that operate in all 4 nations of the UK, and they're all different. So I understand why that is, because public health is a devolved topic, but that's an issue that I've come across. I was wondering if you had any comments on that.
I'll maybe pick it up straight away and see if some of the team want to do it. In terms of health and safety, of course, the Health and Safety at Work Act covers the whole of GB. And so the overall elements of that are the same. But we do work very closely with the devolved administrations, and where there is an emphasis, for example, in Scotland or Wales, for example, then we will clearly reflect that. And if there are particular differences, which are much less so, of course, in the context of health and safety, we would also reflect that in the area that we are working and having to interpret it. On the question on public health matters, such as it requires us to act, that is, we always interpret that totally in line with the devolved administration's way of interpreting it. So we don't sort of try and mix and match and do it together. We take the interpretation which is appropriate for the business in that area. So we try to be consistent, and we try to make sure that we do keep up with everything that's happening in those different areas. I just asked my team, is there anybody in the team wants to add or supplement that in any way?
Hi Martin, it's Tracy Hamilton.
Yeah, go for it.
What I would say is I've been a member of a number of working groups working both with the English, Welsh and Scottish governments independently. And I would reiterate what you said in that in terms of a policy position, my advice to those working groups has been consistent across the board. The only difference that I have seen from a policy angle is that these businesses are opening up on a different time scale, but my advice has been consistent, irrespective of where the business is based.
Thanks,
Okay.
Tracy. Thank you.
Thanks for those answers. What I have found recently is the Welsh Government has issued some working safely guides as downloadable PDFs, which is similar to the English documents. I tend to look at gov.uk mainly, but I have to look at the Welsh information as well. But just to move on to just a very quick question, if I may, is on terminology. We're talking about safe restart, safe recovery. Other areas of documentation are talking about COVID secure. Now, if people are nervous about even going shopping or going back to work, presumably that may be because they think they're not going to be safe. And maybe that's because they think you can never guarantee complete safety from something like coronavirus. So I know this terminology is probably being decided on by the government, but I can see a barrier psychologically by calling it safe, because I would expect there's a lot of people that would regard it as it's never going to be completely safe. So this has come up in the past with other areas of health and safety, but I'm just wondering if there's any comment there from the HSE at all.
Well, I think that we always use these phrases about proportionate and reasonable, practicable solutions, if you like. But I don't know whether is it David or Claire or Tracy want to cover on any answer on that particular point, because we are about controlling risk. Not always. While you can eliminate some risks, most of the time you're controlling risk, and you've got to look at what's proportional, reasonable and practicable. And I think that still applies to the public health aspect here. And that's why people say it doesn't matter what the rule is, so you must make sure you look at social distancing, and you must make sure you're looking at good hygiene. Tracy or anybody, do you want to pick up on that again?
Martin, can I pick up? Is that okay?
Yeah, go on. Whichever one was that? Was that you, David?
Alex Chavlos. I think one of the things to bear in mind is, and I think it reflects what you were saying before, Martin, about the sort of hierarchy of control. You build the safety by putting the right measures in place, and that's part of that COVID secure approach. And things like washing of hands, the social distancing, the 2 meters, we know that those things work. Relying on face masks and face coverings, they rely on, are they appropriately fitted? Do they, are you sort of wearing them the right way? Do you take them on and put them off properly? So whilst that does provide some level of control, it's nowhere near as good as keeping 2 meters away and washing your hands, which is why we're really pushing those messages. The other thing, of course, is as businesses, you can do a lot to control your environment. And that's where we get into the areas of things like providing fresh air and good ventilation in workplaces, and the sort of the wider hygiene controls in terms of cleaning down various touch points. Because we know those things work, and that builds that level of security. And I think one of the things is, as you were saying, Martin, making sure that your employees know that that's the process and that's why these things are done, and that they're done, and that members of the public understand what you're doing. And that's that whole importance about, you know, that information when people step over your threshold, so they know, here's a place that's asking me to do these things to keep myself safe, and they're telling me that they're doing things to keep me safe. And that builds that confidence up. Okay,
shall we put back to you, Paul?
Thank you for that. Yeah, Alex, I'd just like to pick up something there. So Martin made reference to proportionality. Now, we've talked about best practice with regards to, you know, restarting and reopening offices, for example. I just wonder if you just touch upon the proportionality in terms of what you're proposing there, in terms of, you know, the level to which some of the businesses on this call, for example, should be considering cleaning solutions, should be considering various elements of that restart program, given that, you know, many are still operating from home and maybe aren't planning an immediate return to the office. Just some thoughts on that would be really helpful, please.
There's quite a few dimensions to that. Shall we take in sort of bits there and pick up about cleaning regimes, and then probably David might want to come in on, or somebody might want to come in from my side on working from home and the issues around working from home. So is it you, Claire, who would pick up on cleaning? Somebody's on mute. Everybody's on mute.
Tracy, you're on mute.
Is it you, Tracy?
There you go. Yeah, I hold a policy for the industry, so yeah. Yeah, I mean, there is no sort of definition or no specific timetable for how often you should clean. It all comes down to your COVID risk assessment. You may very well, it will depend on your flow through, it will depend on the location of touch points. Sorry. Did somebody ask a question?
No, keep going.
A bit of noise on the line, Tracy.
All right, okay. So yeah, it's not a one size fits all, is what I'm saying. You do need to think about all of the issues that your business will face, in terms of the people who are coming through your doors, the regularity of people coming through your doors, the points that they will touch much more regularly than others, and then putting in place a cleaning regime. And it doesn't have to be, or the latest evidence and the scientific information is, it doesn't have to be anything more than standard cleaning solutions and warm water. But if you're going to use those cleaning solutions, your cleaners must know how to use them appropriately. They must follow the usage instructions on those products. So that's pretty much all I wanted to say, is that you need to approach this on an individual basis.
Alex? Yeah, Alex?
There you go. I was just going to say that I think that one of the things here is, one of the things we've seen from questions we've had from various industry inquirers is people trying to overcomplicate this. You know, people are talking about cleaning and deep cleaning. You know, it's a bit like people arguing about, is it swimming or wild swimming? It's swimming. You know, cleaning down things with your regular cleaning products is going to remove the virus. Don't try and overcomplicate things. General ventilation is going to make things better. Don't try and get too sophisticated. Don't tie yourselves in knots trying to think about sampling the air and all these sorts of things. It's those basic controls that are going to work. Think about the changes that you've made and whether those changes are really going to make things better, or if you're going to cause other problems in other areas. We're advising people, you know, put up screens to, you know, at tills and all those sorts of things. But think about, if I put lots of screens up, is that going to stop ventilation? Do I need to think about the ventilation I've got in there? Do I need to change those approaches? If I'm locking down access points to my business because I've got a number of different entrances and exits, think about, have I now created a fire risk? Do I need to make sure that if I set off a fire alarm, everyone will be able to get out because my staff know things, the different procedures. So it's thinking through those things. This is, whilst COVID is new, the concept of risk assessment and managing risks should not be new to any of you. This is a new risk for us to deal with, and we just need to take it forward in that proportionate way. And I think the other thing is also revisit that risk assessment after you've got it in place and you've started to operate, just to say, is this really working? Am I managing the flow of customers? Are my employees not ending up bunched up in places because I've got pinch points? To help manage those sorts of processes, because it's unlikely you're going to get your risk assessment and all your procedures perfect the first time. You may need to adjust some things as you learn more on how they're really bedding in your organisation.
Yeah, and in terms of cleaning, that's where reasonably practicable would come in. It's not reasonably practicable or proportionate for you to employ a cleaner at every touch point in your business. So this is where you need to think about the flow of people through the premises. And one other point I would just like to raise, because it has come up a couple of times, I've been asked about chlorine-based products. So do people pretty much need to reach for the bleach, take that as the first port of call of a cleaning product? And that is not the case. Using that can create additional risks, additional unintended risks. So that's why I would just like to re-emphasize your standard off-the-shelf cleaning products with warm water are totally effective if they're used correctly.
Back to you, Paul.
Thank you. Thanks, Martin. Alex, would it be helpful just to touch upon, you mentioned about implementation of these particular sort of risk assessments in practice won't necessarily be perfect all the time. You've obviously got a spot check regime underway, and you've mentioned in the chat about detailing some of that and the approach to enforcement. I think it'd be really helpful for those on the call if you could just emphasise a couple of the points around enforcement and the process involved in a spot check.
Okay, the approach we're taking at spot checks, so we can spread our net as wide as possible and engage with as many businesses. What we're doing is it's basically a three-stage approach. The first stage is a basic phone call where you'll be asked particular questions. So if somebody rings you up saying they are ringing on behalf of the health and safety executive, don't just put the phone down thinking it's some crank caller, please. Ask them what they want to talk about, and they'll be asking you very basic questions. There'll be nothing confidential in that conversation. So they'll be capturing questions about, have you done a risk assessment? What is your approach to this? How are you dealing with these sorts of issues? If we get the right responses to those, then we park that business. We're not going to pursue you any further at that stage. If some of those responses give us cause for concern, or it's a business who doesn't want to engage with us, it will move up to a second stage, in which case it'll be a further conversation to clarify some details, maybe ask you, you said this, could you send me a copy of your risk assessment, or could you send me a picture of the thing that you said you were doing, because we didn't quite understand what you were trying to communicate there. If a business still fails to satisfy our understanding of what it would take to be COVID secure, it will move on to stage 3, and that's a boots on the ground inspection. So an inspector will turn up and talk to you saying, well, we've had this engagement with you, we've still been unable to resolve what these issues are. We'd like to talk this over and see what the issues are. Now, that's mostly been done on HSE businesses so far, but the local authority side is also starting to build up. And in effect, as Martin was saying, what we found is that actually most businesses are COVID secure, or a little bit of advice was needed just to clarify some issues. We are not finding high levels of non-compliance. In fact, most businesses are compliant. So that's what we've been finding, and quite often businesses that get to stage 3, it's a lot of just failure to communicate with each other appropriately, people not understanding some of the questions we're asking, or not wishing to engage with us on some of those topics. In terms of enforcement, HSE's approach to enforcement, and I hope anyone who's had engagement with HSE would understand this, and with local authorities, it's about that sort of pragmatic, proportionate approach to managing risks. So we start from the position of trying to work with you to get you up to the standard you need to be via advice. If there are some major problems there, we may be at a point of thinking about we need to issue some sort of improvement notice. So the minimum day for compliance with an improvement notice is 21 days. And for most sort of COVID-related stuff, we'd probably be thinking of giving you the minimum period for compliance, because these things do not require massively complicated solutions in the main. Prohibition notices are possible, but for most COVID-related issues, probably wouldn't be the way we would go down. However, what there is also in this, we're sort of stepping beyond health and safety here, we're moving to the public health side, is obviously with the newer legislation relating to COVID, is some of the public health legislation, local authorities, public health officials have got the power to direct closure to manage serious imminent threat from COVID. So that's beyond the health and safety side of things. The confusion may be when, especially for the local authority side, the local authority environment and health officer might be wearing both hats at the same time. They might be there as health and safety and there as public health. But if there's ever any confusion about what they're talking about, what they're trying to enforce, please ask them and they should be able to explain exactly what they're trying to achieve. But what we're trying to do in the main is we are trying to work with businesses to get them up to the right standard. Okay, back to you, Paul.
Thank you very much, Martin and Alex. If anyone wants to come in on any of the points around spot testing, please do feel free to chip in. We talked there about the reopening, and we talked about a little bit about best practice. We talked a little bit about enforcement. David, you dropped us a note on the chat there about ways of ensuring staff can return to work quickly, or preventative action around infection, and we talked about outbreaks earlier. Would you like to come in at this point just about the likes of PCR testing and some of the preventative measures that businesses can take, and then I'll bring Shane in on the same issue if I can.
Yeah. Okay. So our role at Randix Health, most probably know who we are in terms of our work with NHS. Our approach for getting companies back into work is the rapid PCR test. That's the only one to definitively say if you've got an active infection. We don't advise people to go to the antibody test because there's not enough research done about it to actually say, there's not much scientific background to say, look, you can go back to work based on an antibody test. So that's why we actively promote the PCR test. Companies are now that are facing in terms of production, rail flights going over to overseas. People have to have a negative PCR test to fly with a return to or fit to fly certificate or return to work certificate. This is becoming the norm now, and that puts companies at ease in terms of is my employee is going to be infected. They're in contact with a lot of people, and that's especially with a lot of the rails, airline pilots, production workers as well. So it is quite interesting now that when we see where flights are being cancelled, it's because there's not enough regulatory information around, look, we need to say everybody needs to have a PCR test within 72 hours before they go away or into a new area to test and trace, basically.
Thanks, David. Shane, can I bring you in a little bit on sort of preventative action and testing and measures that can be undertaken by employers to get employees back into the office, both ahead of time but also in the event of an outbreak. I'm just trying to fix my chat function, by the way, so I've got everything that has been sent to me up till a few minutes ago, so I'm going to try and work on getting that back so I don't miss any questions. Thanks, Shane.
Okay, yeah. I mean, in terms of testing, I mentioned before that anybody who's showing symptoms will need to get tested straight away. And then following that, obviously the government have made the announcement yesterday that anybody who is showing symptoms or has a positive test will need to isolate for 10 days, not 7 anymore. And then, of course, anyone that they live with would also need to isolate for 14 days. Under the test and trace program, even if you are isolating because you've been in contact with somebody who is a positive case and you then subsequently request a test and it comes back negative, obviously that will only tell us at that time whether you are a positive case or not. And it doesn't say that, you know, you haven't yet developed symptoms and could then develop symptoms later down the line. So under the test and trace program, regardless of any test result, you would still need to isolate for 14 days. So there is no way that we can get people back into work any earlier than that 14 days under the test and trace program. So hopefully that kind of answers the question from our point of view.
Right, my chat function is working again. Would anyone from HSE like to come in on that in terms of testing regimes? Thanks, Alex. You're muted, Alex.
There you go. Not specifically about testing regimes, but linked to that back to work side of things. If you've got a large workforce, inevitably, because COVID is out there, you are going to get members of your workforce who will come down with COVID at some point. I think you have to understand that. If you've put in the right social distancing measures and control measures in your workplace, what that means is the likelihood of them spreading that infection within your workforce is greatly reduced. And there are things you can do within that, in addition to that, in terms of where people do need to work in teams or work together, to not rotate teams, to keep people on fixed shifts as far as possible, just to reduce those number of contacts that could spread the condition wider. And that could really make the difference in your workplace in terms of having to close down your whole workplace, or just to say, you know, that shift or that team are off, everyone else is okay because we think we've got it contained. And okay, that person would have brought it into the workplace, but it wouldn't have gone wider than just them and their immediate team. So think about that, especially for larger organizations, what you can do to sort of add those internal partitions in your organization.
Paul, you might want to, in response to an early question, which was about working from home, and one of the biggest issues that is coming to the fore from companies and to us is about the stress and mental health aspect of all this, because people are not sort of working from home, they're at home trying to work, if you see what I mean. And that brings all sorts of other dimensions into this and challenges to people. So I wonder if Rob Vondy particularly wants to come in on the stress and mental health bit, and then perhaps either David or Claire come in.
Yes, I will do, Martin. Thank you. And good afternoon, everybody. Yeah, I think we've spent a lot of time talking about the physical issues, the logistical issues, the social distancing, the hygiene requirements and PPE. But a massive challenge is dealing with the mental health and well-being issues, that both being at home in lockdown and then returning to work safely, COVID secure, however you want to badge that, you know, they go hand in hand to me. How do you deal with that? Well, I think from working at home, you had an initial spike in anxiety for employees being told and having to work from home in the lockdown. And now that people are getting used to it, they're looking to get back into work, and anxiety levels and concerns will rise again. Those who are still working at home, we've provided a lot of advice and guidance to help support line managers, team leaders, owner managers, maintain engagement with their people. And it does come down to having conversations that help to reassure people that they're not forgotten, you know, they're not out there and sort of invisible, that they're still tuned in. And these conversations can be socially based, work related, but that it's happening. And that is so important, that people feel they're still connected. And we've produced the Talking Toolkit as guidance, practical guidance, which provides a framework for managers to engage with their employees. I think we've found that lots of supervisors, team leaders, managers, owner managers find these conversations can be quite difficult. So we're trying to provide prompts so that they can ask questions that will penetrate through the barriers of "how are you doing? I'm okay" response. It's trying to be a little bit more psychologically savvy in asking questions to get behind how people really do feel, the issues they have, the anxieties they have, not only at work, but coming back into work. And I think it's incumbent upon employers, small, medium or large, to ensure that they're reassuring their employees, that they're building the employees' trust and confidence in the fact that the workplace they might be returning to is safe and secure. And you can only do that by having good communication and engagement. And I think our talking toolkit fits the bill in both respects. You know, it's trying to make sure that people are involved. If you're doing risk assessments to ensure the workplace is going to be safe, how are your employees involved in that? They're the people at the sharp end who'll be fearing the harm. So how can they be engaged to build their confidence so that they feel more comfortable going back into work? And I think we've spoken, Paul, previously that we're working on developing a health application for small businesses in particular, which is based on a risk assessment approach, but it's condensed, it surrounds the factors that cause stress in work. So it's the management standards factors, but we're trying to make it as easy as possible for small businesses to do that and do it on a mobile phone, any app that they can use that will provide for that. And alongside that, we've been doing an awful lot of communications work, use of social media. We've tried to work very closely with all the business intermediaries. And this webinar is an example of the rolling program of work we've been doing around the country with chamber members to ensure that they're getting the right information and understand the practical ways, because it's about keeping it simple and practical to deal with this major challenge. And I'll stop there.
Over to you, Paul.
Yeah.
Thank you, Robert. Shane, can I bring you in at this point, because I know we were talking earlier, and you posted in the chat to me privately about the Live Your Life Well, and it might just be a good time to bring it in, and then I'll come back to I think Charlie and Kevin have made points which we'll come back to in a second once we've talked about this particular item. Thanks, Shane.
Okay. Yeah, no, I saw a few people around the room there smiling when Martin said that people were actually trying to work from home rather than working from home. And, I think we all recognise the challenges of doing that. I've currently got my neighbour drilling holes in the wall, so if there's any background noise, then that's what it is. But yeah, just wanted to pick up on in terms of what's going on in Liverpool around population health and well-being. Obviously, the impacts of COVID-19 have been far and wide for lots of people and have affected people in lots and lots of different ways. So we've been working with John Moores University to undertake a health impact assessment of the kind of initial findings to look at those impacts. And what they've kind of proposed is that we're expecting 4 waves of impact, both direct and indirect impacts. Obviously, first and foremost was the direct impact of lockdown and of COVID-19 and people actually getting the virus and becoming unwell, the mortality rates associated with that. The second part of that, of course, is what we're all very worried about at the moment, and that is a second spike, which we're all working hard to try and avoid. The other impacts, of course, relate to the delays in people receiving care through the hospitals, people with longer term conditions that have been in lockdown and kind of unable to get out and manage their conditions well, that there's potential exacerbation of that, and that'll lead to further issues with morbidity and mortality. And then, of course, there's the economic impact, economic injury through redundancies, unemployment, business failure, those kinds of things. And then also, the lifestyle choices that people have kind of made during lockdown, and possibly drinking more, smoking at home, not being as active as they normally would be. I know that's certainly affected me personally. But it is, those things are all, concerning us in local and national public health terms as well. Certainly in terms of local unemployment levels, and people with poor mental health, physical health conditions, where, we kind of need to get people, raise awareness of this kind of thing. because prevention and early identification of all of those issues is really critical. So we in public health, we've actually, a while ago, we developed a website as a kind of front shop window, if you like, for all of the services that are available for people in Liverpool to access. The website's called Live Your Life Well. We have updated it recently with more information about how all of those kind of lifestyle issues and services are being affected by COVID. Most of those services are, continuing and have continued throughout the lockdown, providing telephone support. But as I say, we have got that website available, and we can circulate the link to everybody, along with some infographics that we've developed after this session, so you can look through that. It's got information on there about things like stop smoking services, alcohol support, being physically active. It's also got information about mental health and well-being services. So, from the very kind of mild to moderate sort of self-help issues to having someone to talk to, befriending services, that kind of thing. But if you're very concerned about your own or someone else's mental health, then this is a website that you can go to and find information about those services that are available to support people in Liverpool. So as I say, following this, I'll ask Paul and Anthea to circulate the infographics with that information and the website to everybody. So if you could all please share that with your staff throughout the business, that would be really, really helpful. Thanks.
Thanks, Shane. We will make sure that coming out of this particular session, we'll circulate all the information both related to the talking toolkit. I think the app that Robert mentioned it's looking at September as a launch. Is that correct? Your chief executive was saying last week, I think. That's right.
It's going through internal testing at the moment, and we're looking to have it out by the second, third quarter, Paul. And I think I mentioned last time round, we'd really welcome chamber members testing it out before we go live, just to get some real feedback from those people who we hope it will help, but they can tell us otherwise if necessary. But I'll come back to you once we've got the green light to do that.
Perfect. Hopefully one or two volunteers from this particular session can contribute to that. Before we move on to Charlie's question, which is in the chat, does anyone else want to come in on this particular agenda item when you look at mental health in the workplace and some of the strategies and resources that are available to help in this particular space? No? Okay. Charlie, you asked on the chat, is there a higher risk if someone is occupied in a multi-occupancy building due to the ventilation system servicing multiple offices or companies?
I'll pick up on that, and also I'll pick up a little bit on the second question that's been asked there as well, which is about there's a question there on risk assessment, the question on elevated risk. The important thing to remember with this is your businesses aren't generating the virus. What you're risk assessing is the chance of transmitting the virus. So it's not about what the health effects are or anything like that. So what your controls are there to do is to prevent minimizing risk of transmission from one person to another. So always keep that in focus with any risk assessment. On the issue of ventilation, if your workplace resembles a lift with 20 people crammed in it and they spend 8 hours in there all day with no air movement, that's a really, really high risk of transmission. If your workplace resembles 4 people standing at the corners of a football pitch in the fresh air, you've got pretty much the best ventilation you could have, and you've got pretty much zero risk because nobody's going near anybody. Now, 2 extremes, and most people will sit somewhere in the middle. So if you're assessing the risk from a ventilation system, providing that it's bringing in fresh air from the outside, blowing it in, and it's then immediately going back out again, that's the best thing to have. Good quality air has been a part of health and safety and welfare arrangements long before we had the pandemic. We always talk about number of air changes in a room gives you the quality of the air that you've got. If you've got very low number of air changes, can have low air quality. And regardless of how that air gets moved, whether it's a fan, whether it's cooled and heated, it doesn't matter. It's not really going to affect the change. The key here is getting fresh air in to push stale air out. The only thing to remember is, and we've probably all got them in our businesses, that really, really small meeting room that's got that air conditioning system that's fixed in the ceiling. and it's only there to keep the room cool. It doesn't actually bring air in from anywhere. It just literally circulates the air in that room. It's the one that nobody knows how to work. It's either too cold or it's too hot. Probably put one person in that room, and that's it, and they use it as a room. That's where you, if you do have an issue, that's where you're going to have your higher risk. So just think, so always think in the back of your mind through your risk assessments, through, is this going to cause us a problem? Does it increase the risk of transmission? Fresh air being blown in doesn't. A very small room with lots of people in it, with very stale air, just being recirculated does. If it's that, you need something to do about it. If it's fresh air coming in, you don't need to do anything about it. So that's just, hopefully that's balanced the concept of what a risk assessment is and what it should look at, and saying just assess your ventilation systems. And if you've got a very fancy system, and some people do have these, if you've got a control on it where you can switch it from bringing fresh air in only and taking that recirculation function off, like most of us do in our cars, there's a little button we can press to get fresh air in, or we recirculate the cabin air. If you can stick it to the fresh air only, that's the best thing to do. If you don't know how to do it, speak to your heating and ventilation engineer or the manufacturer and see if they can come along and do it for you. But fresh air is good, stale air is bad.
Thanks, David. That's really, really helpful and insightful. Kevin, I'm going to come on to your question. It's quite a long one. Are you okay to come in and just and ask it in your own words, please?
Yeah, not a problem. Can you hear me?
Yeah, thanks, Kevin.
All it is at the moment, what I'm doing is we're going around risk assessments, but they're all with regards to responsibility of departments. And you've got a number of people with fears coming in there. We're getting risk ratings of high, which is basically saying that death is almost certain because of the information that they're getting. So when we come back to sort of push back on that, we're getting a lot of sort of reasons saying that we may be trying to get people back unsafely. And it's apologies. And basically, all it is the more information that we've got available to sort of present, or more facts and figures that we've got to present them can help us and reassure our employees coming back. Because a lot of the barriers that we're getting is around that reassurance that they need. You know, ultimately we're doing social distancing, hand hygiene, spacing, etc., working patterns, but still there's a lot of sort of fears there, and it's just trying to see how much information's there to overcome it.
Thanks, Kevin.
What's the fear, Kevin, if I may ask?
The fear is basically that they're going to catch it, and because in some areas we've had 2 people who sadly died because of it, it can be quite raw. So there's a fear that, you know, and I understand in terms of transmission, that's fine, but if they get it, they may die, and that's a lot of fear that's in place there, and especially those who are not shielding necessarily but have got medical conditions as well. So we're trying to reassure them that actually, you know, it's as safe as physically possible. We can't get rid of it because of, you know, the nature of it, but we're doing everything, or we've done everything that we can to make it as safe an environment for them as possible.
The employer might be doing that, but how involved are the employees in getting to that point of saying, look, we're now as secure as we can be? Is there much employee engagement going on?
We put that at the heart of it, basically. So what I've been doing myself is, before anyone comes, we're doing induction courses and question sessions to ask the questions that they're fearful of. From my background anyway, as a scientist, I'm trying to explain the sort of basic science of what a virus does and how it transmits, and the reasons why, the social distancing and hygiene in there. And that seems to be going well. But then you've still got the sort of likes of the unions who are pushing back, because ultimately they're looking after their members. We're involving them, explaining it, but they still want to go to the empty green. We've got this reasonably practicable that we have to work behind, and they want to go to the, you know, the absolute in some effects. So we have to be sort of balanced with regards to how we're addressing this. But the employees have to be involved, and they are involved in these discussions.
Good to hear. Thank you.
So, Kevin, you mentioned in the chat, you know, is the HSE compiling data and information to help assessors accurately measure the risk rating?
Yeah, it's more about information around, you know, one of the good things is we're always hearing about this 2 meter distance, but then, you know, if someone's 1 meter away or has to walk past someone, there's a fear that we're breaking down, you know, breaking the guidelines, when in fact, you know, passing someone in, you know, who's 1 meter for like 1 second is the equivalent to 2 meters for 15 minutes. That sort of information that we can compare and comparison and sort of explain to them that actually it's all based on risk ratings, it's all based on a hierarchy of control, and that's what we're coming through. But if it comes from an established place like the HSE or Public Health England, it sort of backs us up rather than being an opinion of mine. A lot of ours is factual. We have to justify what we're doing, and it's good to have that sort of backing from the likes of these public bodies and HSE and Public Health England, etc.
Kevin, I think, I don't know whether David Clare or Alex wants to come in, but much of the guidance that we've got, even the high-level stuff behind this, does explain about social distancing and the context in which, you know, it can vary, can the answer, but there are lots of areas where it can, we make it quite clear that social distancing in the right way in the right place can be a very safe place to work, likewise hygiene, and all those sort of things. That actually is in the background in a lot of our guidance. And, you know, it does come to the table quite a lot in our helps and advice line. So I think that information's there, but I don't know whether some of the team want to point you even more specifically to where these sort of all-round guidelines are.
The other thing to consider is there's a definition of what is a close contact in the event of an outbreak, because that will give you those higher risk distances and situations. So if the controls, and say, you know, and you are minimizing the risk of transmission, if all of them sit out from what's defined as a close contact, then again, you know, the risk is as low as reasonably practicable. And again, there will be situations which are lower risk, such as we've seen, people have organised corridors, for example, a bit like if you're going on the tube or up an escalator. You know, one side goes one way, one side goes the other way, and provided you don't, you know, if you meet somebody, you can, you know, simple things is you can turn away, and it's a fraction of a second, that would be considered low risk. And you just, you know, people are organised themselves so that perhaps, you know, some people have gone to the lengths of putting a, you know, a sticky hazard line down the centre of a corridor. So you walk one way down one side and back down the other side. Some have even gone to the extent of putting one-way systems in. You know, you can do these things, but I think I would look more towards the test and trace definitions of close contact, because that will give you a grounding. And if the measures that you have sort of comply with those, then that's what, you know, far brighter people than me have studied that and looked at, you know, the that's where the risk of transmission is greater if you go beyond, or you go under those limits, as it were.
The issue of staff confidence is absolutely imperative here, isn't it? And we're talking almost exclusively about, you know, the working environment solely, and that's where the obligation for the employer sits. Of course, one of the big challenges in terms of retaining staff to work and then being confident is the role of public transport, which is my rather inelegant way of bringing Suzanne into the conversation at this stage, if I may. Suzanne, just from a public transport perspective, can you just maybe give a snapshot of advice for the people on the call, just to talk about how some of the reassurance can be provided to their employees about returning to the office or undertaking transport to and from work?
Yeah, so good afternoon, everyone. So during the COVID peak, we were affected as a business. We had staff who had to self-isolate, and as a result, we had to reduce our timetables and run a restricted service. And that was to ensure that we could still run a reliable service for those who needed to travel. Now that lockdown restrictions are beginning to lift, we're in a position that we've been able to strengthen our services. So as restrictions regarding retail and hospitality have eased, we've been able to add more services, and we'll be looking to do the same again as hopefully commuters return to the network in September. While we've been reinstating our services, we've been really clear in our messaging that it is likely that during a journey by public transport, you won't be able to socially distance at times. And this is a message that is running across all public transport, and it's the national position as well. And because of that, it is mandatory now to wear a face covering when travelling on public transport. So with regards to the government message, when COVID was at its peak, the government advice was that public transport was for key workers and those making essential journeys only. And as restrictions have lifted, we moved to a message that public transport was just for essential journeys, and then it was for necessary journeys. And now we're in a position where those restrictions have lifted, and people are free to use public transport. So our priority now is to make passengers as confident as possible in travelling by public transport. So we want to build that confidence and to help people feel as safe as they can when using public transport. So from our perspective, there are a number of things that we've done. So we've introduced signage at our stations to remind passengers to socially distance where they can. We will have queuing systems at our busier footfall stations, and when it's required, we'll also have social distance marshals. We've increased our cleaning regimes, and we are using specialist products that create a film for up to 30 days, and we're using those on touch points, so grab handles in trains and those areas where we do have high footfalls of passengers. Our advice to passengers and to anyone thinking about using public transport is that they must wear a face covering. There are exemptions, so if for medical reasons people can't wear a face covering, they are exempt, and we're providing cards for people. You can download them from our website, and they're also available at stations, so passengers can travel with their cards that shows they're exempt. We're really pleased in the fact that around 90% of our passengers are wearing face coverings, and we're just really focused now on continuing to communicate that message and to educate passengers going forwards. We're using all of our internal communication channels, so digital, website, but we're also using media outlets as well. So we've got radio adverts on Capital FM, and we're using other media partners just to educate people into the new norm of travelling on public transport. Key messages are to avoid peak times if possible, and this is something for employers to think about going forward. From our perspective, we would like to extend those peak hours and to see less people travelling over an extended period of time to reduce congestion. We're also advising passengers to leave more time for the journey. It is likely if they have to queue, they won't be able to get the train that they were hoping to. So that's really important as well. We're encouraging passengers to use contactless payments, and obviously hand hygiene is key as well. So to carry hand sanitizer and to wash the hands as much as possible. So going forward, we'll be closely monitoring the situation. We've got a team focused on this, and we'll be strengthening our services where we can to meet the increased demand. Our website contains all of the latest travel advice, so if you're thinking about returning to the workplace and you'll be a commuter, or if you're looking to provide advice to your employees, our website is the best point of contact. I'd also suggest visiting the Mersey travel website and other operator sites for different modes of advice on different modes of travel. But I hope you found that useful. Thanks.
Thanks, Suzanne. That's a really excellent summary. From a public health HSE perspective, are there anything in terms of your resources to support what Suzanne is providing through Merseyrail, in terms of providing some reassurance on the lines of what Kevin was talking about, in terms of reassuring staff and communicating some of those messages? Shane?
Yeah, I was just going to say that I was going to mention before when Kevin was talking that And one of the things that we're working towards is being able to have a kind of report that can be published on Liverpool City Council website to kind of give an update on the kind of infection rates in the local area. We're a way off that at the moment. Obviously, we're getting a lot of information that's coming back from Public Health England that we need to interpret and put into a usable format. And obviously, it needs to be checked and that kind of thing. So we are a bit of a way off that. But that would be a good piece of information to kind of reassure the public of the rates of infection. But in terms of risk assessments, I mean, obviously, the fact that we have the virus in circulation in itself it means that we need to take action to mitigate those risks of transmission, just like David was saying before. So, as I said, we are working towards producing that document, publishing it, but it could be a while off yet before we get to that point.
Sure.
Alex. Just a comment in terms of wearing face coverings. Just one thing is always to remind people that the offence to not wear a face covering where you should be wearing one is upon the individual who is not wearing the face covering. Businesses themselves are not required to police members of the public wearing face coverings. I think it's reasonable to say that businesses should remind customers that they should be wearing face coverings if they're entering the place that they should, a sign as they go in. And businesses, of course, are within their rights to say, if you don't wear a face covering when you should be wearing one, we're not going to serve you. You might as well go away because you're not going to be a customer here. But it's not a requirement for members of staff, because I know that there have been some issues of members of staff facing some quite sort of vicious attacks and verbal abuse from people when they have confronted people about wearing face coverings. So the police will get involved. It has to be said that the police are probably more going to get involved if it's a sort of public disturbance type issue. And I know in the Prime Minister's announcements at lunchtime, he said that there will be action to increase police profile in places where face coverings are required. But it's just about it's about the individual and putting the duty on them, not expecting sort of local workers and people working in restaurants, etc., to be policing the public themselves.
Thank you for that, Alex. That's helpful. I'm conscious that we're 27 minutes over, so if everyone's okay for a 1/2 finish, I have one final question, if I may. A lot of the individuals on this call from businesses are in an environment where they are, in ordinary circumstances, required to visit other premises. Can we just spend a moment just to maybe just provide some insight into what the obligations are on businesses from a perspective of risk assessments or safeguarding and otherwise, for organisations who traditionally will have people who are required to go into other workplaces, and some of the steps that they can take to mitigate any risks that might entail?
Who's going to pick that up from our side? Is it Claire, Tracy or David?
I can start, Martin.
Yeah.
I think as an employer, you've got a responsibility to look after your employees. Now that also extends to visitors to your business. So from that point of view, we would expect you to treat your visitors as you would treat your employees, and the standards should be the same. If you've got a business relationship with another business that you visit regularly, then I would encourage you to start a dialogue between the two companies before the visit, so that the expectations can be agreed by both parties before you set off. And that would just seem to me like a sensible, practical solution to the situation. So if I'm going to come and visit your business, I'm going to ring you up and I'm going to say, I plan to come on this day. What are the control measures in place that you expect for your employees? What do you expect me to do? And come to an agreement with how we can then make the visit happen safely. David, do you want to come in and add to that?
Yeah, and do
exactly on visiting other people.
Yeah, and do exactly the same if you are then meeting, for example, if you're going to work in somebody else's home. If you go to obviously gas engineers is a great example of people who work in other people's homes. Now we have published some guidance for them. It's on the Gas Safe. It's hosted at the moment on the Gas Safe register website. So if you're a plumber, if you're an electrician, you know, I'll go and have a look at that. But again, as Claire has pointed out in visiting another workplace, somebody's home then is your workplace, and again it's having that upfront conversations before you go, and that's probably more about you explaining how you are going to be COVID secure, if you like, in their home, as opposed to if you were going in as a commercial heating engineer into a factory, asking them what they're doing so that you know what you need to do when you arrive, and you know where to go, and you know who to see. So it's a slight little bit of a reverse way, but again, it's as with all of these things, and Rob will be the first one to say, communication is the key. And the good communication, targeted communication, it gives the comfort and the confidence on both sides that everybody's happy. They know what to expect when somebody knocks on the door or rings the bell onto the business, and that person going in knows exactly what to do. Everybody's comfortable with those controls. The work can be done, and you've got happy customer and happy contractor.
This is something that's come up a lot for us with our Gas Safe register engineers. You know, how to approach going into somebody's home and being sensitive to if people are shielding right the way through to what they do if people are just being plain awkward.
Another group that this is also a big issue for are all the sort of engineering inspectors doing thorough examination and testing. And there is also guidance on HSE's website about that. And also groups like SAFED, and I'm afraid I've forgotten the name of them, who represent the forklift truck industry, have also got guidance on their websites as well, that we've been in discussion with them to help them develop. So those are basically professionals who are visiting a number of sites, doing those sort of engineering checks and so forth, so that those sort of pressure systems and forklift trucks can keep on working safely.
One of the areas, Paul, that we've had some of the biggest complaints, if you like, people coming in, is in transport and logistics, where lorry drivers have been turning up at warehouses either to pick up or to deliver, and have been denied access to go to a restroom or wash or get washing facilities. And the comment very often is they're keeping their staff safe. Actually, that is not acceptable. It is a requirement to make sure that these drivers do have access to such facilities. And actually, we would chase people up if they were denying access to people who were turning up on that. It really is up to you to find a way of getting around it. And when you think about it, it's only human as well to allow these people proper facilities.
No, absolutely. Thank you for that, Martin. Look, I've broken my own rule there because it's now 2:33. So I am going to bring the proceedings to a close. I just wanted to get a sense of whether everyone felt that the 5 objectives that we specified at the start of this have been met. If they have, fantastic. You can give a cheesy thumbs up if you want to. If they haven't, or if there are any particular, thank you, Andrew. If there are any particular questions, queries, or concerns that haven't been addressed, or you'd like to raise anything offline, please feel free to do so, either through myself or through colleagues who are on the call. I think the final thing for me to do is to thank everyone who has participated, thank our partners, growth partners. Thanks to the Health and Safety Executive, to Shane and Matt from Public Health Liverpool, and once again to reiterate our thanks for all of their efforts in recent months. Thanks also to Suzanne from Merseyrail, both for such a really concise piece of information, having waited so long to join us. We will continue these types of events and engagement pieces through the coming period. As I say, it's our aim as a chamber is to make sure that the information that we're providing is as valuable and as authentic as we can possibly provide. Sometimes that means sessions go on longer than I expected, but I hope you found the information that you've received really, really detailed and informative. On that note, I hope everyone has a really, really good weekend. Enjoy the sunshine whilst it lasts. And on behalf of the Chamber and partners, thank you so much for joining us, and we'll see you very soon. Thank you.
Thank you.
Thanks, Paul. Thanks, everyone.
Very much.
Bye.
Bye.